Hello and welcome. Today we're going to talk about how you take a research idea through the process of research all the way to a paper and other dissemination. I'm making this video because I've supervised lots of students and junior doctors who find the whole process of research very difficult to navigate. It's very hard to know the next step, let alone the way through the labyrinth. So, to illustrate, we're going to use the example of osteosarcoma of the great toe. Now, I know nothing about osteosarcoma of the great toe, but supposing we had a research idea where we thought paracetamol would be a really good treatment for osteosarcoma of the great toe, we're going to work through how you might conduct a research project to address this. 3 steps to doing research: preparation, the massive step, doing the hands-on research, and dissemination. So, first of all, preparation. And I can't emphasize enough how important it is to get this right before diving in with the research itself. If you want to get high quality research, you need to spend time at this stage. First of all, you need to read the literature. What do we know already about the topic? What are the big outstanding questions about osteosarcoma of the great toe? What treatments are people using already? What are the things we don't know? Is it already treated really well, or is there a high mortality and a need for new treatments? Is paracetamol already an established treatment for osteosarcoma of the great toe? And then you need to come up with a research question. Ideally, you want to address something important. There are thousands of potential research questions you could address, so you need to think about the opportunity cost of picking any one of them. So questions that tend to be more important are those with more common disease or a more serious disease, or ones where you're addressing an important aspect of a disease. Often there's a little bit of a compromise between, on the one hand, what you're interested in addressing and what it's possible for you to address with your existing resources, time, money, data, patients, etc. And this tends to be an iterative process. As you read the literature and start planning, you might refine your research question a little bit. One good way to formulate a research question is using this acronym PICO. So P is for population. So we started with a fairly vague research question about, does paracetamol work for osteosarcoma of the great toe? Let's try to refine that a little bit more. So the population in which we're interested is adults with non-metastatic osteosarcoma affecting the great toe. I is for intervention, and here we've defined it as oral paracetamol between 500 milligrams and 1 gram, taken at least twice daily for at least 2 weeks. Of course, we could very easily choose other parameters there. Our comparison group is those with osteosarcoma, adults with non-metastatic osteosarcoma affecting the great toe who have taken less than 500 to 1000 milligrams of paracetamol twice daily for 2 weeks. And the outcome we want to know is death at 5 years. Does paracetamol impact that? Now, our question about paracetamol works quite well for PICO. Sometimes you're interested in research questions where it's not so much an intervention, but it could be considered an exposure. And here you can adapt it to PECO. So if we were interested in whether having green eyes affects your impact of, it affects your mortality in osteosarcoma. Again, a stupid example. Here we could use PECO and have that as our exposure. So when planning a study, it's useful to start by thinking of the ideal study. In an ideal world, if we had all the resources at our disposal, what kind of study would we do here? If we had no logistical or ethical constraints, And often that's a randomized controlled trial. So we might take a large group of patients with osteosarcoma of the great toe and randomize some of them to receiving paracetamol and some of them to not receiving paracetamol. We might even have more than one group where we have different doses of paracetamol. And then often you need to compromise and say, okay, well, osteosarcoma of the great toe is very rare, we're not going to be able to recruit people, we don't have the funds right now to do an RCT. What other study might we be able to do? We might be able to do a prospective observational study or a retrospective observational study. And then we need to consider the additional skills we might need. So, for example, if we're doing this an observational study on osteosarcoma of the great toe, we might need additional statistical expertise, and you might need to go away and do some training. Other expertise you might need, say, neuroimaging or wet lab. And when planning a project, I find it really helpful to talk to lots of different people, and the emphasis is on different here, because different people bring lots of different perspectives. So you might want to speak to orthopedic surgeons or oncologists who have lots of expertise in osteosarcoma. You might want to speak to people with expertise in clinical trials who know nothing about osteosarcoma, haven't heard of osteosarcoma before, but have lots of experience running trials, or statisticians, and it's often helpful to involve people with lived experience at this point as well. It can give you a perspective on what matters to patients, and they can be helpful in identifying recruitment barriers as well. Pre-registration is increasingly a part of research, and I find it really helpful not just for the transparency of my research, but also to make me do good research, because when it comes to the analysis stage of conducting the research, if you pre-registered an analysis plan, you're then not trying to think, oh, do I need to change, should I change my analysis one way or another, and you can be biased based on the results you're getting, whereas if you just pre-registered it, it's much easier to follow that protocol you've come up with. Of course, there are reasons why you might need to deviate from your protocol, but you can justify them, and that's fine. There are a number of sites you can pre-register on. Often institutions have their own repositories. I tend to use the Open Science Framework website, which is super easy. You can either just upload a document you've written yourself, or they've got various templates you can use for pre-registering studies. Then you need to assemble a team. If this is your first research project, you're almost certainly going to need a supervisor. And increasingly, research studies have large teams, but it is perfectly legitimate to have a solo research project or a very small group. You might need to involve specialists, both in the method you're interested in and the disease you're interested in. And if you're collecting the data yourself, you might need a team of people to support with that. Ethical approval is where a lot of people can get unstuck when doing research for the first time. The first question to ask is, does it need ethical approval? So some studies, like reviews, which use existing published data, or audits, tend not to need ethical approval. Audits will often tend to require some local approval. The next question to ask is, if the study does need ethical approval, is whether there's already ethical approval in place. Is your study a sub-study of a larger study where we already have the ethical approval? Or are you using an existing data source that has overriding ethical approval? If you do need ethical approval, if you're working in a university, your options are generally either university ethics and NHS ethics. Generally, if you're involving NHS patients, you need NHS ethics, which can be quite a long and laborious process. Otherwise, you might be able to go with university ethics, which tends to be a little bit quicker. So that's planning and preparation. We're now on to the exciting bit of doing the research. Now, there are two possibilities when it comes to data collection. You might already have the data, and that sounds like an absolute win, although often it can take a while to negotiate access to the data and the security requirements around that. Moreover, if you haven't collected the data yourself, the data are unlikely to be your ideal data and how you'd want them in an ideal world. So there are pros and cons. If you are collecting the data yourself, on the other hand, it can be extremely time consuming. There are additional ethical implications if you're collecting new data from patients. One tip is to pilot a data extraction form rather than making a spreadsheet or a database to collect all your data to start with and then try collecting all your data on 200 subjects and realizing you've got it wrong at the end. It's much better just to sample it on a small group of subjects and then revise it. Data cleaning is one of the areas of research that is not talked about enough, but it's actually where a lot of the important decisions come in that can introduce bias and can change the representativeness of your sample. There are a few steps I go through when I'm cleaning data. The first is to ensure you have the variables you need. So in our example of osteosarcoma, we're going to need their mortality at 5 years. We're going to need the amount of paracetamol they've taken, for instance. The next step is to sort out your variable names and labels. Make sure that they are named in a way that is comprehensible to you and ideally to others too. Then you want to put your variables into the correct format. So date variables need to be formatted as dates, numeric variables as numerics. Often your variables might come as characters, and that can be because of some glitches in some of the observations. So it's worth working out where those glitches are before you convert to a data or numeric format. And then you need to sense check your variables. Are they actually sensible before putting them into your regression model? Do these variables actually make sense? And there are a number of reasons why they might not make sense. Firstly, there might be duplicates. You might have the same patient enrolled more than once. There might be missing values, and that might make sense, or that might be problematic. There might be ways in which you can fill in that missing data. There might be extreme values. I remember one research project I did where I found a massive difference between two groups, and it turned out that this was because hemoglobin had been measured on two different scales. So if you do have, it's worth plotting out your data just on a dot plot or a box plot or a histogram, just to see what it looks like. Are there any extreme values that don't make sense or make you suspicious? And then the next step is to think about your variables relative to each other. Do they make sense given the other information you have about these patients? So for example, if you're looking at the cure date for their osteosarcoma, you might want to check that it comes after the diagnosis date of their osteosarcoma. You might want to check that their date of death comes after their date of paracetamol usage, for instance. And that's obviously going to be quite individualized to your data set. Then you almost invariably need to create some secondary variables. So for example, if you want duration of life after diagnosis with osteosarcoma, you might need to create a new variable based on their date of diagnosis of osteosarcoma and their date of death. And then you need to implement your eligibility criteria. So generally, not all the patients on whom you've collected data are eligible for your study. So you need to find a way of removing those who are not eligible. That's the data cleaning. What about analysis? The first step in analysis is to present some descriptive statistics. This is to show your reader what your sample looks like. Are they representative? Are they what do they look like in terms of their age, sex, race, ethnicity? And you might have some other variables here according to your specific patient group. So this was a group of psychiatric patients, and we reported their primary diagnosis and whether they were involuntarily detained. And often this ends up in the table 1 of your manuscript. After your descriptive statistics, really exciting bit, you get to do your main analysis. This might be a regression, very often a regression. It might be a t-test or a chi-squared test, but very often it's a regression of some sort. And so here we might be trying to work out the relationship between paracetamol use and mortality. And we have a slightly different graph here, looking at the relationship between distance to destination and airfare cost. Sensitivity analyses you conduct after your main analysis, and the point of a sensitivity analysis is to address a potential criticism or limitation of your main analysis. So for example, in our study, if we found that paracetamol had a fantastically bad effect on mortality, we might think, oh, this is driven by elderly patients in our sample who are who tend to be more unwell, are taking lots of paracetamol. Maybe we should exclude them from our study in a sensitivity analysis. So we're not excluding them from the entire study, but from this particular analysis. And you might have a number of these. Sometimes they involve different approaches to missing data. A subgroup analysis is slightly different. A subgroup analysis is where you found an effect in the main analysis. So say paracetamol was associated with a much better survival, and you want to zoom in on particular groups and see how the effect differs between those groups. So for example, we might want to see if the effect of paracetamol holds in males and females, or we might want to see whether it holds in people with more advanced osteosarcoma and less advanced osteosarcoma. So we can examine the effect in different subgroups. So that's your analysis. Now on to dissemination. This is where you get the word out about your research, because there's no point doing it if people don't know about it. When we think about dissemination, often the most obvious form of dissemination is the research paper. The write-up can, of course, start earlier in the process. It's often wise to start writing your introduction early on to see how you take to academic writing. And you can often write your method as you go along. You should certainly be making notes for your method as you go along. And sometimes there are parts of the data collection or the analysis where you don't have much else to do, and the write-up can be part of your focus at these points. My number one tip for writing up a research paper is to look for a reporting guideline. The Equator website here has 655 reporting guidelines at the time of broadcasting this, and these are essentially cheat sheets that show you what to put in a research paper of various types. So this is the Strobe statement, which is for observational studies, and this one's specifically for cohort studies. I use this all the time, and it tells you what you should put in. You can use it as a checklist. You can use it as a structure for your paper. There tends to be more detail on the methods and the results. The introduction and the discussion, in contrast, tend to be a little bit more free-flowing, and you get a bit more scope to use your creative flair. The methods and the results should be very factual. my other big tip in writing up is to use some referencing software. Imagine that you've spent hours formatting your paper to submit to one journal that requires you to have superscripted numbers with your references. And then you get rejected by that journal and you submit to a journal which requires you to have alphabetical references. This is potentially a vast amount of work if you've got 200 references to go through and do all that manually. With referencing software, you could do it in a few seconds. It takes a small amount of time to set up and to get used to, but it's generally quite user-friendly. The software I use, which you can see here, is something called Zotero, Z-O-T-E-R-O, and it's free to use. It integrates with Microsoft Word and with Google Docs. And if you go to YouTube, you can see lots of tutorials on how to use it. Right, so you've written your paper. Let's get it into a journal now. There is a bit of an art to choosing the right journal, and it's something that senior people with lots of experience of different journals tend to be much better at than junior people. Things you want to look at when choosing a journal are the rigour of that journal. Is it respected in your field? The subject matter, is it appropriate? A really common reason for rejection of articles is that they're just not within the journal's scope. So read what the journal wants to publish, read what they actually do publish. The speed, sometimes you're in no rush to get a paper out, sometimes there is a bit of pressure, so it's worth looking at how quickly a journal processes manuscripts. Impact factor, which is a measure of how many times papers are cited in the journal. Reach, so how many people read the journal. And do the groups you care about reaching read the journal? You might care about particular clinicians managing osteosarcoma, or you might care about statisticians when you've implemented some really novel way of conducting your analysis. And then realism as well. We might all want to get our first paper into Nature, but you need to think through how good your paper is, how it compares to the papers that that journal tends to publish, and adjust accordingly. It's worth being a little bit ambitious to start with if you've got the time, and then reducing your expectations thereafter. Right, now this is the submission process. The diagram we've got on the right, which I'll talk you through, is a representative good outcome, but there are various other pathways that you could take. So to start with, you format your paper, particularly if you're starting off. This can be a day's work to get it ready for the journal, and you submit it through an online manuscript submission system, which can be a little bit tortuous. At this point, an editor has a look at it. Sometimes there's a technical check before you even see the editor, where they check that you've done all that formatting stuff correctly. Pass to the editor, and the editor decides whether to reject it straight away. It can go in the dustbin at this point. This can be frustrating, but in many ways it can be quite a satisfying outcome if you get a very quick turnaround from an editor. Just a day or two later, great, okay, I can move on to another journal now. They may, if the editor likes your paper, they will tend to send it out for peer review, which is where other people in your field will evaluate your manuscript and give comments on it. And at this point, after peer review, it goes back to the editor, and they may again decide, no, the peer reviewers didn't like it, let's bin it. However, it's possible that the peer reviewers like it and the editor likes it, but there are some reservations about it, in which case you'll be asked to revise the manuscript. Often there is a deadline of a few weeks in how long you have to revise the manuscript. You then revise this and send it back to the editor, and the editor decides at this point whether they want to bin it because you haven't made sufficient changes. This is quite unusual. or whether they want to accept it, and we can skip the next couple of steps, or whether they want another round of peer review. So they might send it out to the peer reviewers again. Usually it's the ones that have reviewed it first time round. It might be one or two extra reviewers. And again, the reviewers make some recommendations, they send it back to the editor, and the editor decides whether to give you another chance to revise it or whether to bin it. If you get a chance to revise it, you can then you send it back to the journal, and hopefully by this point they think you've done a wonderful job and they accept your manuscript. There's then a little bit of a delay while the journal sorts your manuscript into a format they want to publish, and then they send you a proof of the manuscript, which looks like how it's going to appear, usually as a PDF. You have a look through the proof. There's usually a very tight time scale for looking through the proof. You send it back to the journal, and then hopefully not too long later the article is published online. If the journal also has a print publication, there's often a lag between the online publication, usually a month or few, but it can be a year or two before it's actually published in print in an actual issue of the journal. Of course, we mustn't forget other forms of dissemination, so social media, institutional communications, posters, presentations, submit it for a prize. If it's really big news that would capture the public's attention, a press release, and think about other forms of dissemination as well. Use your imagination, so podcasts, for instance, or YouTube tutorials even. So in summary, preparation, you need to plan, pre-register, think about your research question with Pico. Doing the research, you need to collect the data, clean the data, conduct your analysis. Dissemination, you want a paper, a poster or presentation, and think about a prize submission. Thanks so much for watching.